What is going on, Savage Life family? I'm making this video here on a Sunday just to explain to you the hype that's going around Ocugen or Ocgn, which is their ticker symbol here. Now, in the after hours, they shot up 64%. That's $3.37, which is huge for a pretty much penny stock like this because it was under that $5 range, which is when it's under the $5 range is considered a penny stock since it's unable to be listed on the NASDAQ here. But now that it's above that $5 range, and if it can maintain this price, it's going to be attractive for a lot of institutions such as hedge funds and etc. So if you don't know what Ocugen is, it is a biopharmaceutical company focused on discovering, developing, and commercializing transformative therapies to treat blindness diseases. Now, what shot this stock up was several things, but one of the things we're going to start with was an analyst here who works for H.C. Wainwright. His name is Robinhood, and he raised his price rating on Ocugen stock on Thursday from neutral to buy and placed a $4.50 price forecast on its shares, and as you can see, it shot right past it. So it seems he was right on the money on that. Now, as well as this, Bharat Biotech, makers of the Rona vaccine Covaxin, is expected to start phase 3 clinical trial for the pediatric population by the end of February or March or early March this year. Now, they have been researching here. As you can see on their page, they've gone through 90 clinical trials across 20 countries, and they've tested 150,000 adults, 550,000 infants, over 700,000 volunteers. Now, if you are an ethical investor, meaning if you don't believe in the morals of certain companies, then this company is definitely not for you, because they are conducting clinical trials on children, infants, and young adults. And if you are against that, then I'd say avoid investing and putting your money in this company here, because what they're trying to do is conduct antibodies in children for the Rona vaccine. Now, we do know that in the US alone, there has been a total of 2.8 million child Rona vaccine cases reported, and 1 to 2% of those reported cases resulted in hospitalizations. So what does that mean? Is that children aren't really affected by the Rona as much as adults. It hits their body differently, and since they're young, their body adapts quicker, and those antibodies prevent them from turning Rona into a serious case in most cases. So this vaccine is going to be from those children transmitting those viruses onto their parents, their grandparents, their uncles, their aunts, and any adults they have in their life, which is the major issue going on now, and it's going to help children return back to school in multiple countries which have canceled school for children across the globe. So the deal that Ocugen made with Bharat Biotech that was announced earlier this week, under this agreement, Ocugen will co-develop, supply, and commercialize Bharat's Covaxin experimental Rona vaccine for the US market. So it's currently being developed for India at the current moment, but this is going to expand their reach over to the US market, and as long as FDA approval is achieved for emergency use, then this could cause Ocugen to explode. Now, this report that I'm showing you here shows information describing how Covaxin effectively neutralizes the UK variant of the Rona, reducing the possibility of mutant virus escape. Much of Ocugen's future growth prospects now rest on its ability to obtain emergency use for Covaxin in the US. Thus, investors should brace for major volatility in Ocugen's stock price as it raises and advances towards clinical trials. Now, if Covaxin does obtain emergency use authorization or approval in the US, Ocugen will make 45% of all the profits from the vaccine sold from Bharat Biotech. So it is a win-win situation for both companies in the sense that Bharat Biotech will now have a reach in the US markets and have lots of revenue coming from there, and as well as Ocugen will have revenue coming from all directions in terms of sales in India and sales in the US market. So the enthusiasm about Ocugen could evaporate if Covaxin doesn't make it to the US market, and Ocugen has already begun talking with the US Food and Drug Administration, which is the FDA, about a potential path to an emergency use authorization and ultimately an approval. Now, the results from these discussions will be critically important as to whether or not the biotech stock can keep its momentum going up, meaning this $3 hype here is just anticipation to this approval coming and people gambling some money in hopes that the approval does go through. Now, it will be the first trial in the world in which pediatric population from toddlers to teens will be tested for the Rona vaccine. But as per international regulations, only vaccines based on inactivated viruses can be administered to children under the age of 16 years, meaning the rotavirus, which is the current active virus, is unable to be administered to children under the age of 16. So it's going to be extremely hard for Bharat Biotech to receive approval. But since this is a global pandemic, and we have yet to have a global pandemic since the early 1900s, there is quite the possibility for approval to go through. Now, earlier in January, the DGCI, which is the Drug Controller General of India, gave approval for administering Covaxin to children above the age of 12. But later in the month, the government disapproved this authorization as it was deemed unethical. Now, Bharat Biotech is submitting a proposal for Covaxin trials between kids of age 2 to 12. So now we have to await the government's final decision. It all depends on the government's final decision. Now remember, this is not the US government we're talking about here. This is the Indian government. And it's funny to me how they later disapproved the authorization for children above the age of 12, but now they're submitting to propose trials between the ages of 2 to 12, which isn't that worse? You know, it's like you're going under the age requirements. You're focusing on, now this is children since they're under the age of 2 to 12. So in my head, that seems like it's more unethical than children above the age of 12. But we'll see what happens in that sense there. Like I stated, it all depends on how much of a necessity this vaccine is going to be needed. And this is the only thing really holding Ocugen up. As you can see here, their eye therapeutics are still in the preclinical stage. The furthest one along is a OCU 400, which is almost about to enter phase 1. Now, I want you guys to understand how long these clinical phases last. Now, phase 1 usually enrolls 20 to 100 healthy volunteers or people with the condition of being studied and lasts several months. Phase 2 continues to measure safely while also looking at how effective the treatment is and carefully investigating its side effects. And this phase typically lasts several months to 2 years. And then phase 3 lasts from 1 to 4 years. And after phase 3, you have to receive FDA approval. And after you receive FDA approval, you go ahead into phase 4, which then enters the market but continues to become monitored. So it is a extremely long process to get approval for these therapeutic medications, drugs, whatever it is pharma related being introduced into a market. So if you are planning on investing into Ocugen for their eye therapeutics, keep in mind that this could take this is a years worth of investment here that you're going to be bag holding the company for until you see positive results. In the case of this Covaxin deal that they made, if you plan on investing into Ocugen for the hype of that, it would be a good time to buy now at the current moment and hold on to it for the next 1 to 2 months to see what happens, because that is what we'll see the government's decision on approval for these trials. So it wouldn't hurt to put a couple hundreds into it, depending on the size of your portfolio, of course. I'd say don't put more than 5 to 10% of it, since this is a cheap stock here to buy and you can see massive results, but it does carry high risk. So if you guys enjoyed this video, be sure to smash that like, subscribe, and comment. I'll catch you guys on the next one. See ya. Again.